Jamie, let me know when you want me to come on screen.
Will do. Thanks, Pat. All right, welcome everyone. It's a couple of minutes after noon. We thought we would give you guys some time to settle in and get your bite to eat. Welcome. This is our third installment of Wellness Wednesdays. For those of you who have attended before, we appreciate your return. Welcome back. And for those of you who are new here, you are in for a real treat. Wellness Wednesdays is a new virtual monthly series where editors from Minneapolis.St.Paul magazine, like myself, I'm Jamie Korf, pair up with some of the most in-demand influencers in natural health. These virtual sessions serve as a jump off from editorial content that we've produced over the past several years with the experts at Northwestern Health Sciences University, the Midwest's leading school in natural health care education. The topics that we have dually dissected and covered at length before range from natural remedies in menopause to the mental health benefits of touch therapy, food intolerances and sensitivities, and demystifying lower back pain or any type of chronic pain for that matter. Truly nothing is off limits. And when it comes to, the everyday one-off or kind of acute mysterious ailment, rest assured that this field and this assemblage of highly knowledgeable practitioners have an answer or a solution for that. And it's never going to be a short-term fix. And that is the beauty of looking at our health through a whole body, top to bottom holistic lens. If you do want to read our work, head to Mpls.Mag.com, navigate over to the health and fitness tab, and then you'll see posts, they say sponsored on them, that are kind of peppered throughout. I'll leave a direct URL in the chat box for you all to access. So for the past two webinars, if you've been following along, we've explored different practices or philosophies in naturopathic health and Chinese medicine. Namely the Naturopathic Guide to Vitamins and Supplements. That was our first one. And lastly, the most recent one was following the Chinese medicine body clock for optimal sleep. Today is going to be a little bit different. We are going to be kind of uncovering the educational and professional pursuits behind one of the more popular practices in Chinese medicine. And that practice is acupuncture, which you've all heard of by now. It's something that's gradually becoming more accepted among mainstream medicine over the past couple of decades. People are getting acupuncture in emergency rooms. They're getting it done in athletic facilities, hospices, primary care clinics, and so much more, you name it. Today's guest, she'll go into that a little bit more, but as an overview, acupuncture is a traditional Chinese medicine. And it's used to balance the body's flow of energy through the placement of tiny needles into the skin at specific points, pressure points. And it's the stimulation of those points that activate the natural healing response in our bodies. And it results in a number of wide-ranging health benefits, from improving our sleep quality to treating anxiety and depression, lowering stress levels, and so much more. And because of its popularity, I just read something, I think it was on WebMD the other day, about how there are more than 10 million acupuncture treatments that are given in the US every year. But because of its popularity, its evidence of effectiveness, and the fact that it's increasingly becoming covered by medical insurance, people are progressively pursuing this, not only as obviously a treatment modality, but also as a first stop on their career path, or as a second career, as they kind of see it as a natural extension to the work that they're already doing. In Northwestern Health Sciences University is like a first stop for those who are interested in learning more about pursuing a career in acupuncture, really. And we are so fortunate, you guys, to have them in our own backyard. Their acupuncture school and School of Chinese Medicine offers undergraduate and graduate programs taught by some of the very best, top of the charts in the field, which brings us to today's guest speaker, Patricia Casella-Maddox. Patricia, or Pat as she goes by, is a licensed acupuncturist, chiropractor, an educator, and a writer. She wears a lot of hats. She has been in the industry since 1998 in a variety of capacities. So she'll be speaking to what those acupuncture specialties look like, the educational tracks involved, the types of programs offered at the university, the job outlook, and so much more. But one quick housekeeping item, you guys, be sure to drop all of your questions or comments if you have any in the Q&A. We will do our best to get around to all of them as they pertain. If they're relevant to the conversation, we'll bring you in, we'll bring your question in. Otherwise, we might reserve some time at the back end of this presentation for questions that went unaddressed, should we have the time for it. So without further ado, please give a hearty welcome to Miss Pat Casello-Maddox. Welcome, Pat, and thanks for being along for the ride. You have so much to offer, and we can't wait to dig in.
Hello, everybody. I'm really glad to be here today to be talking with all of you and to be working with Jamie. So,
yeah, thanks so much, Pat. Maybe just to get us started, just as a primer, I know I touched on it, very briefly, but it was very, very surface level. Can you describe the practice of acupuncture and just some of the more general conditions that it can treat?
sure. Yeah, acupuncture, and it's part of a larger constellation of types of therapies and things that we do with that. But acupuncture is kind of the primary part of Chinese medicine in the United States. In there, and we treat in many different types of facilities and environments, as Jamie is already indicating. So, for example, our students would treat on the campus clinics. They would be in various hospital systems around the cities. We're in transitional cares, like with stroke patients and spinal cord injuries, for example. A lot of outreach clinics. We have a clinic for working with AIDS patients and with hepatitis C patients. We have Salvation Army downtown Minneapolis, which might be working with people with chemical dependency or homelessness. So there's just lots and lots of environments that we not only train our students in, but actually work in as practitioners out in the field as well. And the things we treat, I've already touched on some things that you might not even realize we work with, but common things we would see would be things like neck and back pain, a lot of musculoskeletal types of disorders. In the sports medicine world, sprains and strains, for example. We also work with asthma, we work with chronic pain, or even more acute pain. A lot of work with women's health, women who are childbearing or maybe having lactation issues or menstrual problems or fertility issues, trying to get pregnant. Also, well beyond those years as well into menopause. Anxiety and mental health is a big part of what we work with. A lot of stress, especially now during COVID. We have a lot of people coming in with a lot of stress-related illness, and we have to address, the stress for them and the emotional kind of fallout from that, as well as other things they might be experiencing, like poor sleep, for example, irritability. So really a broad range of different types of disorders that we work with individually, and we also work with collaboratively or integratively as well with other providers.
Pat, you're listing off all these different conditions and symptoms that it can help treat. And it just made me think to myself, like, is there really any other modality or practice in the natural healthcare world that is such a catch-all treatment that has that kind of wide-ranging power? I mean, I actually went, just kind of on a personal note, a few years back, I went for a series of treatments. I was experiencing some gut health for whatever reason. I think it was just a stressful time of my life. And I would reassess. And after a series of, I think it was like 3 or 4 sessions, there was a noticeable difference. But I'm just wondering, Pat, it really seems like it's kind of it's a power player.
Yes, the medicine is the philosophy of Chinese medicine, including acupuncture, really was developed as a full-fledged medical care. And originating over in China, they designed it originally when they were up against, oddly enough, lots of epidemics. It used to be really kind of reserved for the nobility. And then when you had these masses of people that were getting sick, they further developed, the medicine. And then when Mao was in power in China, he took the best of Western medicine in the research and the best of classical Chinese medicine and put them together. And that's what we've kind of inherited here in the United States from that merging over there. So it really covers a lot of bases. The things that can make a difference here in the US versus how they would use it in China is to what degree and scope of practice. Now, what things do they allow us to do by licensing in the United States? For example, in China, the herbs would be a primary part of treatment, and the acupuncture and Tui Na, which is a medical form of massage, would be kind of the other specialty areas. In the United States, there's a lot more concern about interactions between the herbs and medications, or herbs with over-the-counter kind of supplements, that type of thing. And so
Sure.
they're a little more conservative here on the use of the herbs, although we certainly use it and can use it in our practices. So it is broad. Others, some of them are limited because they're not as well known. Like if you go over into Europe, things like homeopathy are very common over there. That would be a primary one that would treat for a lot of things. And what I'm finding more and more in my practice is that I'm so blessed and feel blessed as a provider that I can work with other healthcare providers to even open those doors further. I have both the abilities and I have the licensing and scope of practice that lets us do that in the acupuncture world. And so it offers a lot to people in our country.
Pat, before we kind of jump in on the academic side, can you share with us maybe something that people do not know about acupuncture that you wish that they did? Maybe it's a perception that you want to myth
Yeah.
bust, or whatever the case might be.
The most common thing I get from people that are not familiar with acupuncture are questions such as, one, does it work? And two, does it hurt? Because here you have this invasive procedure. You're talking about needles, and the needles are very, they're slender. Sometimes they're coated depending on the techniques you're going to do with the needles. But by far, the response I get from patients is, oh, that didn't feel at all like I thought it would feel. And part of that's with training and experience over time, you can reduce any discomfort. That's why our students practice internally on each other first, right? To
Right,
get
right.
the techniques down, and they're more forgiving of each other for things like that. But I think the widespread use of what you can do with it, and the fact that, like medicine, although medicine talks more now, and Western medicine now talks much more in terms of research and evidence, there's still a lot of experimental things that happen. And I think in acupuncture, it is truly the combination of science and art. And I'll give you an example of that. I had a young couple come in that wanted to get pregnant. They wanted to have a baby. And the woman thought that it might be due to issues she was having, although they weren't finding anything in testing. So I worked with her for a while and they still weren't conceiving. And it would drive me crazy at night. I'm like, what are we missing? What are we missing? What are we missing? And finally, I said, I want your husband to come in too. I need to talk with him. And in talking with him, we found out that he actually had some early stages of diabetes, which impacts the formation of sperm. And so people with diabetes oftentimes might have trouble with fertility. And in this case, it was the man. In fact, about a third of the time, it's the woman who has the issue. A third of the time, it's the man. And a third of the time, it's about both.
Oh
And
my
so once we
gosh.
started treating him, they ended up finally having the baby, which was awesome, right? So I was combining what I knew about acupuncture, but I had to combine it with some of the research, that I was finding out there about what's happening with diabetes and
Sure.
of that regarding fertility.
Yeah.
I can give you another example. I had a woman come in with what we call burning mouth syndrome. Anything she ate or drank, it was like her mouth was on fire, her whole interior of her mouth. And she'd been going to various places and no one was really able to help her. And so once again, I started looking at that. We started treating her. And then I started digging into research. And I look at research all around the world, what's happening, because a lot of the research for acupuncture is done elsewhere. And I found over in the United Kingdom, in Britain, there was a dentist who had been working with patients with this. So I took his protocols and used it with her. And like in 6 weeks, we cleared everything but maybe a dime-sized little spot on the upper roof of her mouth. And she'd been going for like 2 years trying to resolve this, And so being willing to go, it's an art, it's a science, you have to combine them, you've got to think through. It's not necessarily every person that comes in with one disorder isn't necessarily going to be treated the same way, because there's lots of factors that come into play in the in the treatment of them. Um, and so that's what I love. You get to be innovative and find ways to help your patients that if it was a much more rigid structure that only allowed certain things, we wouldn't be able to do that. So
Sure. Wow, thanks for sharing those stories, Pat. That's really compelling. I had goosebumps. Um, the first couple that you talked about, really quick here, did he just find out that he had diabetes, or were you part of that journey? No, he just found out, right?
He had just found out. He was just coming out of the service, and he was doing they do a variety of things for exit processes, and then they also get certain privileges after they're out. And so he had gone in and found out about the diabetes. What he didn't know was the connection with the fertility. They weren't talking about that with him because he wasn't talking about the fact they couldn't conceive. So when he'd go his doctor, that conversation wasn't even coming up.
Wow. Oh, right. That's a testament right there. If I've heard one. Pat, this question will probably take the longest. It's a loaded question, but I feel like this is the right time to bring it in. Can you just describe the degree programs that are offered at Northwestern Health Sciences University?
Sure.
And can you also maybe at the end there just talk a little bit about how they may differentiate from other institutions? Maybe what people should be, if they're interested in pursuing this as a career, they want to go to school for it, how do they know if it's an accredited institution or not?
Sure.
Kind of those types of things.
Yeah. In the United States, to be a licensed acupuncturist, and most states required licensing, not all, there's only maybe I think now like 3 states that don't. You have to go to what they call an accredited school, which is governed by the U.S. Department of Education. So we have to meet requirements to ensure that our students are getting the education they need to graduate and be successful and safe out in the field when they go to practice. And so there's a whole set of regulatory and kind of oversight things we have to have built into our programs, and we do. In fact, the university has 8 accreditors for all our different programs. So we're in constantly a state of being, the, the glass looking at us, for all of our programs to be properly set up. And we have been there, originally started out as a chiropractic college, and in 2000 we brought on the acupuncture school and the massage school at the university. So we've been there now for over 2 decades in that role. The acupuncture programs, there's really 3 degree programs that you can do. One of them is the master's program, which is the longest standing one that we've had. We used to have one in acupuncture and one in Chinese medicine, which included the herbs, and now more of that is getting merged. But we right now do have a master of acupuncture. It's 8 trimesters, which puts you just about at 3 years of study with us. It does require 90 degrees of undergraduate credit, and there's very specific types of credits that they're looking for you to come into the program. It is the mainstay, as it is in most of the states. The master's degree for most states is the degree that's necessary to become licensed. You have to be at that level. A few of them require a doctorate level, and a few of them don't have really any clear guidelines around it, but that's very rare in the United States. So the master's level has really been what has been around the longest. It's the most reviewed by the agencies that oversee it. We have the most experience with it, those of us offering the master's degrees in there. And we've had, I don't even know the total number of students we've had come through. I started teaching back in 2005, and I know I've seen hundreds of students, maybe thousands coming, through that time period in one way or another. And so that one would be the one where you would get kind of your basic training in both the philosophy of the medicine, in our case, traditional Chinese medicine, because there is different types of acupuncture. Traditional Chinese medicine, they get their foundational knowledge in biomedicine as well, because we are an integrative school. We were looking for ways to do joint ventures and do with our clinical program is one of our greatest differentiators. I'm what they call a peer review visitor, where I go to other schools to make sure that they're meeting their requirements for accreditation, and then they come to our school. And so I get to see a lot of schools, and we have some of the most robust clinical rotations here in the Twin Cities. We have at least a couple of decades in hospital systems. We've been in 4 hospital systems in the Twin Cities, including places like Abbott Northwestern, University of Minnesota, Fairview systems. We work at Courage Center out in Golden Valley. We work on, as I said earlier, stroke patients, traumatic brain injuries, that type of thing. We have a lot of outreach clinics all over St. Paul and Minneapolis. And so that ability to have students rotate through that many different types and styles of practice really helps them determine kind of what they want to do when they graduate, because they've got a lot of options now. Didn't always used to be the way, but they certainly do now. And this way they get to experience and try it out. And what I find, some people go in and they think, oh, sports medicine would be really cool. And then they get into sports medicine and then go, well, that wasn't quite what I thought it was gonna be, or maybe I really don't like working with athletes as much as I thought I was going to. And so it's a great way. It's kind of like MDs going through their residency rotations, because they try lots of different things before they go into their specialty area. So that's really a big plus for us and a big draw for a lot of students. The fact we're integrated is also a draw for students that really kind of believe it's important to know your own medicine really well, but be able to work with other providers in healthcare, because your patients are going to come from they come from backgrounds where Western medicine has been the norm in many cases for them, and they're getting care there. And so we are learning to be the bridge sometimes between the medicines, which is a skill set that not everybody gets in some other schools as well. So that's the master's program, which is the mainstay. And then more recently, in the last couple of years, we added our doctorate program on, which is in Chinese medicine, which has the herbal components. And there, our students have gone through all of the master's level work, and then they add on about another year's worth of work where they're really going into much deeper concentration of study. They're looking more at research in their area. They give an area they want to focus on in there, and then they graduate. And the doctorate, I think we're moving more and more over time to a doctorate level of education, just like the MDs or the physical therapists have now. And so in that case there, you're really asking the students to delve very deeply into a specialty. So you might be pediatrics, or it might be oncology, or it might be women's health, for example. And in that case, they come out with even that next level of really understanding, which might take a normal practitioner, just like when an MD first goes out into practice, their early years are really then fine-tuning their skills. And that's the same thing for the licensed acupuncturist as well. But the doctorate does give you that opportunity, once you've chosen your specialty area, to go deeper. And then the third thing that we have available is we have a completion undergraduate degree, because people come in with 90 credits towards application for admissions, but they might not have finished their bachelor's. And sometimes you have people that they want to have that bachelor's, they want to have that completed as well. And we have classes available both within the acupuncture programs and our undergraduate programs to do that. The other thing for them about having the bachelor's degree is if they decide at the end of their time with us that maybe they want to teach or they want to go on into research or something, they're going to need those bachelor undergraduate credits as well as the master's degree to be able to do that. So we have some joint ventures, for example, with Concordia. They can go from some of our programs directly into a master's of sports medicine science at Concordia, and we provide those credits for them to be able to go in with what we call advanced standing. They don't have to take all those early credits at Concordia. They're already that much further into that program and will get done sooner with that master's degree. So our programs kind of help them do all of those things.
So Pat, it seems like the master's degree level is kind of not the baseline, but that's where you're going to get your most flexibility in your career, right?
Right. And that's where you're going to start. You're going to go through those classes. If you're on the master's or the doctorate track, you're going to go through those, and the doctorate goes beyond that then afterwards. So the master's is really the core program. And you can always do the master's and then choose later on in the curriculum to swap over to the other one if you so choose.
Okay, sure. Oh, that's great. We do have a question from the audience
Mhm.
here. She says she wants to ask just how, I'm guessing she's asking economically, how economically viable being an acupuncturist is. She's talking about earning potential versus debt. Are you able to be self-sufficient without having to worry about debt for the rest of your life? Which is a very
Yeah,
important,
yes.
very relevant question in today's world.
Yes, it is. Yeah, that's a great question. The answer is I took a look because I know it's going to be on here, and I took a look at what the Bureau of Labor Statistics says about the acupuncture world, and they're still predicting growth into like the late 2020s, about 12% of growth. And the average median salary that they're listing there is about 76,000. I have seen people go from part-time depending on their needs. It is a very flexible career. Sometimes they get out of school and they're starting their family and they don't want to work full-time at first, and they're still able to bring in a decent income. Others I've seen gone in and easily can make six figures. Now that's dependent on where you are and how active you are. In today's world, I think the biggest difference for the acupuncturist today versus before is that things like marketing yourself is so important. Social media, having yourself out there, go and do talks, let people know that you're available in your community is really important. I have people rurally, because we get the 5-state area primarily of students. I have students who are rural, like in Wisconsin, where they might be the only really healthcare provider for miles around like their farm communities, and they're doing great businesses and they're very connected with their communities. I have students that have gone on to work in multidisciplinary types of organizations. We have students that graduated and work down in Mayo now, which make very good money, or work with other health professionals in a group practice in other parts, of the country and the world. I have students over in like Norway, students in East Asia. So the opportunities are there. We took a cruise about 2 years ago, and there was an acupuncturist there, and I found out they're very common on the cruise ships, as well.
Yeah,
What do you want to do?
fun fact.
That you want. And the money, yes, that is a concern. And so you want to be really looking at what does it cost, really work with the financial aid people. If you can afford to like work on the side and pay for your living expenses versus taking loans, that's a big help, but they'll work with you on that. So there is opportunity out there. There's lots of opportunity. And like you said, now it's covered more and more by insurance. And we're working very hard right now to get it covered for things like Medicare. So you can bring Medicare patients in. So there's ways for you to be able to recoup. You do have to be willing to, run your own business, market yourself,
Yeah.
and network with others, really network with others.
Yeah. And Pat, like you said, when you started out in this profession, I mean, that probably, I'm sure there was some emphasis there, but it looked different, right? In terms of the self-marketing efforts and what that looked like versus now. I mean, it's not an add-on, it's just an expected part of your role, right? If you want to get your name out there and differentiate yourselves from everyone else. And
And
yeah,
it's not even just the younger patients, because people are saying, well, the millennials are on the social media. I said, they're all on social media. People
right.
use their phones for stuff all the time now, the
Oh, yeah.
mobile in particular. And so, and you don't have to be on every social media, but pick where you think your patient population is going to be.
Yeah. No, that's great. Yeah. Kind of pick your lane and stick
Yeah.
to it. Yeah, and it's funny, there are stereotypes, but I feel like my parents, for instance, I give them such a hard time and I call them millennials because they're on their phones all the time. They used to give me such a hard time, and wow, the roles reversed. But yeah, more and more, I mean, we're seeing a wider, more ranging demographic on social media.
Yeah.
Um, Pat, I have a question for you. You were talking earlier about, this is really interesting to me, but of course it makes sense because there's, integrative medicine. As a student, you need to be not only well versed in your craft, but also kind of the ways of the Western medicine world. Can you talk a little bit, like just like a peek behind the curtain? Can you kind of give us like a brief curriculum overview, like what modalities or like what philosophies are being taught in some of these classes?
Sure. So in the first year of the program, you're going through some basic things. You're doing anatomy and physiology with models in labs. We also have a cadaver lab that we use. So you actually three-dimensionally get to see the body. We have a special class called needling anatomy where you learn about where the various points, the more common points are used and what that means in terms of depth, for insertion of needles and what other kind of structures or organs, vulnerable structures are around. So we teach you how to be safe with that. And you're literally hands-on with that. As you move past that first year, which also has some other things like physiology and pathophysiology. What does the body look like when it's healthy and when it's not healthy? And as you move past that, though, you get into what we call our topics classes. So there the focus becomes more body region specific or body system specific. So you learn more about cardiology, endocrinology, hormones in the body, the digestive system, the reproductive systems, and so forth. And so you delve further into common disorders in biomedicine. And then at the same time, you're learning about treating from, it's not always identical. I can't necessarily talk about diabetes being the same in Chinese medicine as it is in Western medicine. It's the same to the patient, but how we view it philosophically to treat it is different. So you're learning kind of both sets of paradigms of medicine at the same time.
Sorry, Pat, I was muted. Thank you for kind of just painting the picture. That's really interesting. And it is, I mean, I think people who are new to acupuncture or not super familiar, maybe they get a treatment, they don't understand that. I mean, these people really have to know the body inside and out. I wanted to know, Pat, for those who are, we did an article that went out, and that actually is the one that inspired the session that we're doing today. And it was called The Allure of Acupuncture.
Yeah.
And we talked to a couple of specialists at Northwestern, and they talked about kind of this sort of phenomenon where people are leaving their jobs to pursue a career in acupuncture. So sort of like their second career, and they see it as sort of a natural extension of the work that they're already doing. Can you kind of talk about that, Pat, just from maybe anecdotally or what you've seen from the people that you've taught? Like maybe, what is the common thread among some of those occupations, if there is a common thread, and what is it about acupuncture that they're drawn to?
Yeah, the people that tend to come to the programs aren't necessarily from a given occupation, but for example, when I was first working at the university, we saw a lot of people come in that were in martial arts or related types of fields or areas of interest, right? Because it matched. They understood the philosophy of the yin yang philosophy. They were students of meditation and of internal reflection and all those types of things. And so it was a natural draw for them. But over time, I've seen it vary. We've had people come in from nursing, and that's a natural extension of very caring, compassionate kind of providers that could see that Western medicine couldn't give their patients everything they wanted to give them. And so it was a natural extension to look for something else, another set of tools they could bring, to their patients' care. And we had many of them that have gone on back to their hospital systems or private practice that really have integrated that really well and just have a much broader, universe to offer in terms of healthcare to their patients. I also see people sometimes that come in that are very research oriented. They're really drawn by let me see the evidence. I want to prove this works and then use it, kind of thing. And so they'll come in, and then what I watch is everybody kind of grows in a way, a tougher outer skin because we're alternative medicine, right? And we sometimes have to go out and market ourselves in a different way. People don't know what we do, or they've heard something and it's not quite true, so you've got to be able to kind of bear up under that a little bit. But I see people soften their hearts, their compassion grows so much. And so it's people that really want to give to others, really help them with their healthcare and their self-care and have better lives. and really are open to also growing themselves, because that's the beauty of, I think, of our medicine. And this happens in Western medicine as well. You grow to a different level to be able to serve others, in that kind of way. And so people that I see come in might have come be teachers, engineers, coming from other healthcare professions. It's really broad where they come from, but they usually come in because they've reached a point in their life where they're saying, I really want to serve in a different way. I want to be productive, but I want to be productive doing something that I'm called to do at a higher level, that I can really be, personally and professionally satisfied with what I do. And they don't always come in for the money. The money can be there, but you have to, work for that. But they come in because they really want to serve people in
Yeah.
needs.
Yeah.
Yeah.
There's a driving purpose there. Yeah, that's so interesting, Pat, because it's like when you strip it all down, like a nurse or a caretaker isn't all that different from somebody like an acupuncturist. At the end of the day, it's about troubleshooting, solving their problems, and feeling like they're equipped with what they need to lead a better life with, I guess, a higher quality level of living.
Yeah.
There is, Susan wanted to know, she is a registered nurse. She asks, would my education pathway be different since I have a bachelor's in science? Do you know the answer to that, Pat?
Yeah, I do. One of the benefits of people coming in from a medical healthcare profession is that a lot of your credits will transfer over. And so if you already have your bachelor's, and even sometimes your experience, depending on what your specialties were, may transfer over into credits. And so that will even will allow you to move through even faster. Now, if you'd been a nurse a long time ago and weren't still doing it, the credits then may or may not transfer as easily. But if you've been actively working in the field, you've got a really nice head start already. For you, it would be you'd have to do all the Chinese medicine from the philosophy on. You'd have to do those, but your trimesters wouldn't be as full because you don't have to do all the Western side of it. And then your clinical rotations, you do all of those as well.
Wow. I don't know if I don't know that. Not to say that other people don't know just because I don't know it, but that I never considered that those, and you did say something about the 90 credits, but I didn't know that those credits could be so transferable from the Western to the Eastern side of things.
Like Susan, was that her name? Susan, because you probably do vitals, you do blood pressures, you know about pathophysiology in the body. You probably know a lot already about the pharmacology, et cetera, which the other students have to take that. Nutrition, there might be a lot of things that you're already doing or know about that's going to transfer in. And the best way to know exactly for your particular circumstances would be to talk to the admissions people. They will walk through and identify with you what would transfer and what wouldn't.
Pat, Priyanka wants to know, she says, greetings, I have a query regarding the master's program. Can the master's degree be done alongside of the bachelor's program offered by the university after completion of 12th STD? I don't know what that stands for. Does that make any sense to you?
I'm not sure what she's referencing about the 12 STD, but yes, the two can be done concurrently. Okay. And it's all really dependent on your schedule and how much you want to, pack in. So to apply for it, you have to have the 90 credit. We're a bachelor completion program, right? We're not the 4-year bachelor's, we're the bachelor completion. So you already have to have some things, to kind of walk into the door for that. And if you have and need to have the 90 to be able to apply in the first place. So if you already have some partial undergraduate work and you come in, you can parallel those programs if you want to take on the extra classes, or if we don't tell you can't do the bachelor's or the master's before the other one's done. Most people do them concurrently.
Somebody wants to know, like some colleges and universities, senior citizens can take classes for free or at a much reduced cost. Do you know if there's anything like that available at Northwestern?
We haven't done as much of that. We're so heavily in clinical programs that a lot of our continuing education up to this point has really been for the annual licensing credits needed for our alumni and graduates and other providers out in the field. We do periodically offer some things, and we offer events on campus. And now I believe online, we're doing more of that. Since COVID's come in, everything's flipping, more online, to provide people with free information. I don't know all what they're planning coming up for this next year, because we've been so heavily focused on flipping our programs into online for COVID, and now coming out of that, we're going hybrid. But we're always looking for additional ways to educate the public, as well as be able to offer, continuing education or no credit kind of education. I know that's on the books. I just don't know how much is coming up in the next year.
Okay. Pat, this is a question for me.
Sure.
Before somebody takes the big leap, how do you determine if this is a right fit for you? Are there kind of like trialing opportunities where you can shadow or take
Yes.
classes without
Yeah.
incurring a bunch of debt? What does that look like for someone who's
Yeah.
on the fence?
You can shadow. You would work through our admissions department, and then we would basically hook you up with a student in the program, and you'd spend a day with them, like going to the classes and seeing what they're about and what the students are doing in class. The only thing you might not be able to do is go into the clinics. There might be parts of the clinics you can go see, but not all of them, and that's for the privacy of the patients. And so once you're in the program, you do observation, where you actually come in and watch providers work on patients, both in the curriculum and in the clinical area. So yeah, you can do that. You can, we have discovery days at the university, which is where you come on and they'll tell you all about the programs, show you around, the college, let you talk to the professors, talk to other students who are kind of our ambassadors in there. And so those are great ways to come with no expense to you. You just sign up, register to attend it in there, and then they take you through whatever, you kind of want to see that day. So yeah, there's lots of ways for you to find out more. The other way is to, if you have local acupuncturists, oftentimes I would get, when I was doing my private practice, I would get requests. Sometimes, can I come in and take a look? I'm thinking of going to school. And so then I would check with my patients, it's okay to bring them in. And then we'd set up a date and they'd come in and they'd watch what I do and then ask me questions about it. So yeah, there's many ways that you could take a look without paying a cent. Yep.
Okay. Oh, that's great. So discovery days, is that what you called it, Pat?
Yes. Yep.
Okay, so people will need to kind of keep a pulse on your social media channels to see when that comes. I also wanted to.
They scheduled those out. If you call the admissions department, they can tell you when the next ones are coming up.
Great.
And a lot of those have been virtual, but now we're looking back at opening up, more of the doors to have it back on campus again. So.
This is a little bit all over the place, but in your illustrious career, Pat, how have you seen the perspective of acupuncture and other Eastern medicine modalities sort of shape shift over time? I mean, we know that it's become a more accepted form of medicine by seeing acupuncturists in the primary care clinics or in the emergency rooms, but I guess just anecdotally, what are people saying about it now that they weren't saying about it before?
Sure. I see, when I started doing acupuncture back in 1998, so a couple decades back. Not everybody knew about it, or they kind of knew about acupuncture needles because they might see it in the media. They might see it like in a movie or something, right? But they didn't really understand what it was used for. They would come in and go, well, this helped me with my back pain. And I'm like, yeah, musculoskeletal is really big for what we do. Yes, this can help you with pain in there. And so people weren't as educated about what it could do. So I spent more time explaining to them and also explaining about my licensing and about the safety and the reduced risk of infection with this. You're entering into people's bodies with a tool. And so that was more of the questions. Now they come in with much more specific things and say, well, I had, after my knee surgery, they used acupuncture in the hospital and I got out of there faster and the swelling went down faster. But do you do this? And so they know it works in certain things and they start asking more about other related things. And that we didn't used to get because they didn't even assume that, the work we do with the joints would work very well, you know, and now they kind of know more, at least in the Twin Cities, that's true. I also see other health providers being more open to it. When I was in school, I was doing my acupuncture training and my chiropractic training at the same time. And I would go to hospitals and do observation of surgeries. And I was watching a spinal surgeon one day over at, I think it's now Summit Landmark, is now the orthopedic area. But I went there to watch them, and um, maybe, you know, about a tenth of the time, patients would ask about acupuncture, and he would always give kind of this neutral answer, you know, to them. So at the end of the day, I asked him, because it seemed we were getting along, and I said, I'm just curious, you know, your patients are asking about acupuncture, but you're not really advocating or denying it. I was just curious, what do you think? And he said, I don't know anything about it. I don't want to give them a yay or a nay, because I don't feel that would be ethical. I really don't know how it works or what it does.
Oh,
You know, nowadays that's not always so true, because there's a lot of medical acupuncturists, there's
sure,
MDs that do it,
sure.
chiros do it, PTs do it, you know, and so that's a huge difference. The knowledge base out there in both the providers and in the public has changed dramatically.
Pat, we've got just about a little over 10 minutes left. Did you want to walk us through those pictures from the trip that you took in
Oh, sure.
2011?
Yeah, I'd be happy to do that.
Okay, great.
Can I go ahead and share?
Absolutely.
All right. So just to frame this, every 2 years, we take our students over to China for several weeks, and we work in their hospital systems over there. They get training. It's usually the students that are in their last year of their programs, because now they've gained enough knowledge and they've already been in clinic for at least a couple of trimesters, if not a year or more. And so what you're seeing here, this is a picture that I took. I was there in 2011. I was there with other faculty and administrators, plus 35 students. And we went to both Beijing and to Tianjin, which is two of the northern larger cities in China. And this was one of the statues outside one of the schools. And what I love about Chinese medicine in part is it's very poetic and it's very descriptive in different ways. And this here, you see a little monkey on a horse. And the monkey on the horse represents the idea of that our life is a journey and we're always learning. And over time, we learn to master some things, but we also have things that we don't know. And so we have in part uncertainties about things or lack of knowledge, and we have a lot of certainty and knowledge about other things, and that this is the natural order of things. And so when they're training their students, they're thinking in those terms, that everybody's on this continuum, with some people knowing more about some things than others. And I was just so struck when I was over, but that philosophy permeates everything over there. So while we were there, oops, hang on here, my mouse isn't working. While we were there, this is some of the people that were with me. So we had students, we had other faculty, and we had administrators, and we're in the lobby actually of one of the hospitals we were working at in Tianjin. And it was a great trip. I mean, we spent literally 3 weeks together touring. We went to the Great Wall of China. We went out to eat at all sorts of different restaurants. We went shopping in the local little markets where we got to barter for things, which was awesome in there. But we also were in the hospitals, and you're going to see some of the modalities that they use there. Now in China, integrated medicine is really integrated. The treating provider is doing like this acupuncture. This is scalp acupuncture for this woman. They're doing cupping and other things. They're also looking at MRIs and blood test results and sending people down the hall to get their x-rays or to get some kind of rehab work. And it's all together. We don't see that as much here, but man, it's all together there. So we're in this hospital. What you don't see here is there's about 50 people in this room, including patients, family members, us as visitors, interns working. And this doctor is working with all of us for hours and is so centered, it's crazy. Here they're doing what we call Tui Na, which is a medical form of massage. And in China, acupuncture, herbal medicine, and Tuina are the three main colleges, so to speak, of the medicine in there. And we were able to also work with some of them and to observe. This is a look at what we would think of like a pharmacy would be here in the United States. They have herbal dispensaries, and what you see are the raw herbs in this case that they're using and measuring out and putting together for specific formulas for different diagnoses of patients. So when the patients might leave the hospital or even while they're still in the hospital, these formulas are getting put together so that they can actually ingest those for the given disorder that they have. Here you might see more in the United States of tea pills, little encapsulated pills you can swallow, or you might see that they're ground up into granules and you put them into tea, you steep them in a tea and drink them. But the most potent form of the herbs is in the raw forms. And so in China, they take them home and they boil it down and then they drink it from there.
Pat, and I need to work this in here because Northwestern has an herbal dispensary and it's the largest in the region. Is that correct?
That's correct.
And it's just so cool how the spectrum of herbs can be tailored to treat a very specific concern. When I was pregnant last year, I was given a medication for, I don't know, medication's the right word, but I was given a prescription for sleep. And it was a powder that I would have to mix with hot water. And it was fascinating and it did help. But just wanted to, it's one of like the bragging points of Northwestern, that herbal dispensary is so cool. And a lot of people don't know that we have that here. And it really is, it's a huge gift.
Yeah, and we're getting busier all the time. During the pandemic, a lot of providers went to herbal medicine because they could do telemedicine consults with people and stuff, even if they couldn't have everybody in their offices. And then they would come and they would pick up their packages, their formulas, we call them decoctions. Sometimes they would pick that up to give to their patients, to get that to them. So yeah, it's a great medicine, and it's such a powerful medicine because the formula you took was very specific to the needs you had, right? And every one of those formulas are very specific to what we're treating. So they have a pretty good effect and don't have a lot of adverse effects related to them at all. Here you see cupping. You might have seen that a little bit, like in the Olympics. You'll see like the divers and the swimmers, and they have all these suction cup marks on their back. Cupping is a great way, especially in Minnesota when you have cold and the body tightens up, or you have disorders that happen where the body gets stagnant. Things don't move through the body very well. Cupping is such a great therapy. And here we see a gentleman being treated almost out in the field at this point, being treated by this provider. And this is our school. This is one of our interior courts, which is very peaceful and beautiful. And then we also have a big pond that's out in the local kind of community behind us as well. So it's a very nice campus. And this kind of, in some ways, to me, represents the yin and yang of the Chinese, medicine for us. And then just to look, this is it with the website. If you go on the website and look at the acupuncture programs or the academic programs, you'll see a whole list of things. You can see all the different things that we do here over on the left-hand side. The upper portion is the acupuncture medicine. And on the right-hand side, right there, that lower right is the Office of Admissions, the phone number and the direct email to them. And they have chat hours as well available. So a lot of the questions some of you had to get the specifics right now, like the discovery days, for example, or would these kind of credits transfer in? They're the great people to talk to. They may have you at some point also talk with the dean if they really have to get specific on a given course or something, but we work through admissions first because they can answer a lot of questions, and we've got a great staff. And just wish all of you wonderful health. And if you haven't tried acupuncture, I hope you'll take an opportunity to do that. One thing I didn't mention that we have in the program is we have clinical observation and clinical, we call clinical theater. So part of your education in the master's and the doctorate program is to watch, as part of your classroom, is to watch one of our licensed providers talk you through with a live patient what they do. They do the intake, the medical history and information, and then they talk about the diagnosis, and then they treat the patient in front of you so that you're really getting to see that and have conversation about that. And we're always looking for patients to be part of that, and you get usually a free treatment out of that.
Wonderful. Thanks so much, Pat. If anybody has any outstanding questions or maybe questions that this session spurred for them, feel free to contact me at my email. I'll add that in the chat box here, and I can field your inquiry accordingly. Pat, thank you so much. You come from such a wealth of experience and information, and you've kind of seen it and done it all in your time. And thank you for also sharing those wonderful pictures from your trip. That's kind of a cool add-on too for people to know that that is something that's being done. You said they're in their last year of the program, right? Flying out there and kind of watching all this magic happening on a firsthand basis. I think that's everything for today, everyone. If you missed anything or if you wanted to see any slides, you can go to our landing page, the one that brought you here to register for this session today. We'll have this session recorded. We'll have it posted along with any other pertinent notes. And we are in the process of firming up June, July, and August. So we'll make sure to have that communication out as soon as possible. Again, major thanks to Pat. Pat, thank you so much for the you were the perfect person for the job. I'm so glad that we got you for just this comprehensive view of pursuing acupuncture as a career and why it's become such a draw for so many. And then I would be remiss to, of course, not thank Northwestern Health Sciences University for sponsoring this great series. Join us next month. We're looking at Wednesday, June 16th, same time and same place. Don't forget to sign up. And our door is always open. So let us know what you want to hear about the natural healthcare realm. Thanks, everybody.
Thank you.
Bye-bye. Take care.